Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Nefazodone. Its brand name is Serzone. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Nefazodone is an antidepressant agent derived from phenylpiperazine. Its exact mechanism of action is still currently unknown. However, it's thought that its action is caused by its ability to stop the reuptake of norepinephrine and serotonin. In terms of indications for use, Nefazodone is indicated to be used in the treatment of MDD, or major depressive disorder. Now, before somebody was to use Nefazodone, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. This medication cannot be used by patients who are using triazolam. If a patient had a hypersensitivity to Nefazodone or any other component of the product, as well as other phenylpiperazine antidepressants, they would not be able to use this medication. And if somebody had to stop using Nefazodone in the past due to liver injury, they would also not be able to use this medication. Now, in terms of precautions, patients should be made aware that sinus bradycardia, or a slow heart rate, as well as orthostatic hypotension, which is a sudden drop in blood pressure when going from a seated to a standing position, have both been reported. Patients should be told to avoid using alcohol with Nefazodone. It's not recommended to use this medication within 14 days of a monoamine oxidase inhibitor. Patients should be made aware that convulsions, including grand mal seizures, have been reported with the use of Nefazodone. And visual disturbances, including blurred vision, have also been reported. Patients must be screened for bipolar disorder before starting this medication, as it may precipitate manic or mixed episodes. And lastly, for precautions, male patients should be made aware that priapism has occurred, and if this was to occur, the medication should be discontinued. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Nefazodone, they can expect to receive their dose orally. So if somebody is using Nefazodone to treat MDD or major depressive disorder, they would typically start off with 100 milligrams taken twice daily. The dose can then be increased by 100 or 200 milligrams daily each week to a maximum dose of 600 milligrams per day. As with all medications, there are some side effects or adverse reactions that patients may experience while using Nefazodone, so I'll go over some of those here now. We mentioned orthostatic hypotension was a possibility. This can happen up to 4% of the time. Up to 17% of patients may experience constipation, and up to 23% may experience nausea. Dry mouth comes in at a rate of 25%, and up to 7% of patients may experience confusion. Dizziness can happen up to 22% of the time, and a headache may occur up to 52% of the time. 10% of patients may experience lightheadedness, and up to 32% may experience somnolence. Blurred vision can happen between 3 and 9% of the time. Some more rare but serious side effects would be a dermatological reaction known as Stevens-Johnson syndrome, liver failure, serotonin syndrome, priapism, or angioedema. That's all we're going to talk about today with Nefazodone, or Serzone. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.